I'm Dr. Asha from the Department of Medicine, Bangalore Baptist Hospital. Today I'll be speaking to you about gout. Gout is a type of arthritis and affects the joints, causing pain, redness and swelling in the joints. Gout is caused by raised amounts of uric acid in the blood, and this happens. Uric acid is actually a byproduct of protein metabolism, and uric acid forms crystals, fine needle-like crystals, which get deposited in the joint and can cause pain. Now, what are the symptoms of gout? Gout is usually the symptoms patients present with are they have pain in usually single joint or sometimes two joints, and very rarely multiple joints. The joints which are commonly involved are the big toe, the ankles, the knees, and the patients come with severe pain. The pain of gout is extremely severe and it causes redness, swelling, and the pain is worse in the nights. And the most important feature of gout is that it is episodic. It comes in flares. So the patient will have a flare of gout, and in between patient will be fine, and again another flare of gout. So it is an episodic disease or disease with flares. How do we diagnose gout? Gout is diagnosed by with certainty to a great extent, a great degree of certainty with three important features. The presence of episodic flares, that is patient has flares, then is better and doing well in between the episodes. Again, the involvement of single joint or two joints, especially the big toe, and the high amount of uric acid in the blood. So how do we treat gout? Gout is treated in two principles in the treatment of gout. One is to decrease the pain, and secondly to make sure that the uric acid levels are remain low so that they don't precipitate flares. So for reducing the pain, we use NSAIDs, that is painkiller like ibuprofen we can use indomethacin, but one has to be very careful and know that patients who have liver diseases, kidney diseases or bleeding problems should be very careful while using these drugs. Another very good drug used in the treatment of gout is colchicine. Again, colchicine can cause side effects like vomiting, nausea, loose stools, crampy abdominal pain, and very rarely we also use steroids in severe cases. Once the acute pain settles, we start the patients on medications which bring down the uric acid levels. So these medications are like allopurinol, febuxostat. Now coming to the important part as a part of patient education, what can you do to avoid flares of gout? One thing, most important thing is that you should not be overweight. So exercise, you lose weight. Second thing is stop or limit the use of alcohol, because it is proven that binges of alcohol can precipitate gout episodes. Another thing is many patients benefit with dietary restrictions. So like I said before, uric acid is the byproduct of protein metabolism, especially animal proteins. So diet, which we call it as low purine diet, that is reducing or stopping the use of animal proteins like red meat, seafood, all these can improve and help the patient to avoid episodes or flares of gout. Another thing they have to do is to make sure that the fluid intake is adequate, otherwise it can lead to crystal formation. So all these things, maintaining an ideal body weight, limiting the use of alcohol intake, good oral fluid water intake, and a low purine diet can help you prevent flares or episodes of gout. I hope you benefited from this talk. Thank you.